My name's Zebron Zimba, and I'm from Zambia. I'm here in India at Yashoda Hospitals. I suffered for 3 years with a condition known as Pituitary Adenoma. I came to know about this condition in 2018, December. I'm a teacher, so I was writing on the board. Now, because of my sight, I started writing something that I couldn't even read myself. So I got embarrassed from the children, very embarrassing indeed. So through the Ministry of Health in Zambia, I was connected to Dr. Rohan, the one who was coordinating the program for me to come and have the procedure be done here in India. At that time, the problem had reached a stage where I started losing my sight. My eyes, I couldn't see properly, even moving. I couldn't walk without being helped by someone. I found myself here in India, where I met very qualified doctors, those who worked on me. They did a procedure which I was told should be done through the nose to remove the tumor. The procedure was done very successfully because of these very qualified doctors who helped me to really remove the tumor. I thank also consulting doctor, that is Anandh. He's a very good man. I thank him so very much. I also recognize the presence of Dr. Tumour, very wonderful doctor as well. I had to go through another surgery because I developed a situation which was called pulmonary embolism. So I had my blood started clotting. So these guys, they noticed that even the levels of oxygen were lowering. So then I had to collapse. My life was in danger. They rushed me very quickly to have another surgery to remove the clots, which took about 3 hours. I came back to life. I thank them so much. Yashoda has got quite a number of people who work as a team. We have got the nursing staff. These people, they are so wonderful. They talk to their clients in a calm and nice way. These people were very good to me because even at the time that I could not even lift a cup to drink water, they would come and help me to drink water. I appreciate them. I like them because they are very committed to their work, very focused, and they are humble people. I can assure you that the services that you get here at Yashoda is actually the best in the world. I'm saying this because I have seen with my own eyes how these people, they can work and really help the patient to have the confidence that surely you are going to recover.
My name is Matthew Zimba. I'm a brother to Zebron Zimba, who had the treatment here at Yashoda Hospitals. I came here with him as an attendant to him to be a witness and be a testimony of what has happened here. Zebron was diagnosed some 3 years back, that is 2018, where we discovered that he had a tumor which was growing in his brain. this was proved to be difficult in Zambia, where we wanted it to be operated. Then that side, they referred us to Yashoda Hospital, India. When we came through at this hospital, they had to do their own examination, their evaluation, so that they could establish, I think this is the best hospital where they can come to and have their problems solved. And to my fellow Zambians, if at all you have this opportunity of listening to this or watching this, I would urge the Ministry of Health to refer most of these cases to this hospital, because I have seen what they can do. And I really thank the staff, because they saved my brother.
Hello, I am Dr. Anandh Balasubramaniam. I work at Yashoda Hospital at Secunderabad in India, in Hyderabad. I am the senior consultant and head of department of neurosurgical services here. And we had this patient who came over to us, Mr. Zimba, who had visual disturbance because of a pituitary tumor, which he has been having over the last few years. And due to the pandemic situation, he was not able to travel immediately to get a medical attention. And that had started telling badly on his vision, which he started worsening gradually in both eyes. And being a teacher, he could not attend to his profession with due diligence, and that was affecting his daily activities of life too. When we saw him, the tumor was pretty large, and it was pressing on his optic nerves, which are the nerves responsible for his vision. And when we did the thorough hormone evaluation with our standard protocol with the endocrinologist, we also noticed he had a rare form of gonadotropin secreting adenoma, which is not very common. However, that did not alter our management protocol, and we went ahead in collaboration with the ENT services. We had done an endoscopic transsphenoidal, that is a transnasal surgery, which is done through the nose using endoscopes. It's a minimal invasive approach through which we can enter the skull base and take out the pituitary tumor completely. And in his case, we employed the intraoperative MRI, which is a very unique facility which we have in our hospital, which is a 3 Tesla magnet, which is present just next to the adjacent operating room. When you wheel in the patient in the operative position in the middle of surgery, you get to see whether the surgery is completed and whether the whole tumor has been removed adequately or not. And to our surprise, we did find some bits left here and there, which we went in again and thoroughly removed it, so that he had a total excision of the tumor and a preservation of the normal gland too. And at the end of surgery, he did extremely well, and there was no significant complications initially. And we could even preserve his normal gland to a large extent, that he may not require to take too many hormone tablets for rest of his life. He is only short of a bit of steroids, for which he may require some treatment. During his recovery, we noticed that he suddenly did run out of breath 4-5 days down the line, and we were quite surprised. And thanks to our ICU monitoring team, they could immediately pick up that he had a shortness of breath due to a pulmonary thromboembolism, which was revealed on a CT angiogram. And again, because we are a good multi-speciality center with cardiologist, pulmonologist and intervention radiologist in-house, they could attend to him immediately. And because the thrombus load was too much in the lung, and he had recently undergone surgery, we could not employ thrombolysis. We immediately went ahead and did a thrombectomy, mechanical thrombectomy through the femoral route, and the clots were removed completely, and his shortness of breath improved dramatically, and he was put on anticoagulation so that he doesn't form those clots again. And he made remarkable recovery over the next few days, and we could get him out of the ICU and the hospital uneventfully from there on. So this is a classical example of a patient who has a not so rare tumor like a pituitary tumor, but a rare form of tumor like a gonadotropin secreting adenoma, which was diagnosed by thorough hormonal evaluation, who could undergo total resection using intraoperative imaging like high-end intraoperative MRI. Thereby you avoid giving a post-operative radiotherapy for him, and the chances of recurrence is almost nil. And we also preserve enough normal glands so that he does not require too much hormone replacement post-operatively. And as all these patients require good post-operative comprehensive multi-speciality care, we were able to get him to shore without any major untoward events happening, even though he did develop some post-operative thromboembolic phenomenon. So thanks to the patient for trusting us, and hope with our multi-speciality team we'll be able to serve patients like these with complicated tumors with excellent post-operative outcomes.